People who rely on home carers being left without vital support as a result of high fuel prices. This according to the Home Care Association.
The body, which represents UK care providers, says staff are being forced to leave the profession because they can't afford to drive to their patients and employers can't afford to raise their salaries.
Our reporter Alice Cuddy has been to meet one woman whose care support was unexpectedly withdrawn.
Morning, I'm really sorry. I thought the social workers had been in touch to let you know that our care package with you ended last night. Sadly, I don't have any clients in your area and staff are complaining about fuel costs.
Natalie has been living without professional care support for over 5 months.
So it's really frustrating. We've been constantly on the phone to social services saying, what's going on? Can we have some help, please?
Complications in pregnancy have left her unable to walk and with a range of health conditions.
Antibiotics.
Her husband Jason now has to care for her as well as looking after their young son.
I feel like I'm trapped in this little house. I have to rely on my husband to do everything for me, and that's not what I wanted for the kids. This fuel price hike, it needs to be sorted.
Natalie is not the only person whose care has been affected by high fuel prices.
The shortage of home care workers is adversely affecting everybody that needs help. The high fuel costs are just making that situation even worse. It's really sad to hear Natalie's story, and we're really sorry that she has experienced that and her family. Care workers, they go to work because they want to improve lives, they love what they do, they want to make a difference, and it breaks their hearts not to be able to.
People need care. It's so important.
Natalie's former care agency said it was mortified by her situation. Shropshire Council said they're experiencing a shortage of carers, and the increased cost of living, including fuel prices, adds to this very challenging position. They added, "We continue to work with care providers and clients to meet needs during these difficult times." Since filming, Natalie's case has been reassessed and she has been told that her care should soon resume. But she worries about those still waiting for support.
I have a family, but there are a lot of people that don't have families. Their carers are the only people that they see that day.
Love you.
Alice Cuddy, BBC News.
We should say our thanks to Natalie for sharing and her family for sharing her story. It really brings it home the problems people are facing literally on a daily basis.
And we're hearing so many of those stories, aren't we? We can speak with Louise Didlock, who's a carer, and Dan Archer, who is Chief Executive of a care agency. Louise, let's start with you. I'm guessing you're not particularly surprised by what you heard just then.
I'm really not. That's so upsetting to hear that. But I can perfectly understand it because we just don't get enough money for the fuel that we're allowed to get. The mileage that we get doesn't cover what we use.
And just to be clear, it's not just the petrol that you use, it's the time it takes to get between service users. You aren't always paid for that either?
Yeah. We aren't always paid. We'll get paid for like the half an hour or the hour or so we are in a call, but we aren't necessarily paid for our travel time. And travel time can take anything between, if you're lucky, 4 minutes to half an hour plus, which means if you're doing a half an hour call, you're only getting paid for half an hour instead of the full hour that you're actually at work for.
And it's a very specialist skill set, isn't it, that home carers need to have. I would imagine that the stress of the expense of the petrol of getting to and from the job is going to impact the care that you provide sometimes.
It does, because you're just so stressed about trying to get between clients and still be efficient and good at your job, and just chat to these people, because like the lady was just saying, you are the only person they see sometimes. And it's just so difficult to actually just get between clients and think, well, I can afford to do this.
Louise, good morning to you. So many people are full of respect for the kind of work you do. Can I just check a couple of things? You will work for a local authority, do you?
I do, yeah. Well, I work for a company that's paid by the local authority.
And you're very kindly.
I have,
Okay, sorry, you're very kindly sharing, your story with us. And I don't know how much more you want to share with us, but can you tell us, for example, how much you're paid per hour? Are you happy to share that information?
yeah, I'm paid what the local authority sets. I just want to say that my company has been brilliant and they're trying to sort this out for themselves. But we're paid by the social services, and I'm paid between £9.90 and £10 an hour, which depends on whether I work weekends or not.
Okay, Liz, thank you for sharing all that information because it really matters down, Archie. So just to explain to people, you run a profit-making company.
Correct.
And you largely work in the private sector, but you have people working for NHS and council as well.
Correct. Yeah.
What do you pay?
So we're paying up to £16 an hour across the UK. I think, but significantly, we also pay for drive time in between visits. So that means that the time that's happening between the calls that are happening with clients are being paid to the carers as well. And I think,
You said, can I just
Sorry,
check?
yeah.
You said up to £16
Correct.
an hour. So what
Yeah.
would be the lowest point?
so. In
of pay?
Sheffield, I'm paying £14 an hour. I think the lowest pay rate across the country at the moment is £12 an hour.
So how is it then? We've just heard from Louise a moment ago, and I think
Yeah.
if I heard that right, she's saying she was paid £10.
£9.90, I think she said. Yeah.
Okay.
Yeah.
How is that disparity allowed?
Well, I think it's fundamentally wrong. I think we need to be realistic and say, look, if the amount that a carer is being paid by their employer to cover the cost of fuel is not meeting the cost of fuel, then that carer is subsidising that care package. If the carer is doing work that they're not being paid for by driving between visits, the carer is subsidising that care package. That's fundamentally wrong. So we don't do that. We pay our carers better. We have proper contracts, not zero-hour contracts. We guarantee them pay increases each year. Because we try to look after our staff, we are finding it easier to find staff. But I think it's fundamentally wrong. The sector as a whole is undervaluing the work that's done by carers.
Because what it means is local authorities that aren't necessarily paying that much, people who cannot afford private care like that you provide,
Correct.
are being abandoned in some cases.
Absolutely right. And so in the video packet that you guys have shown this morning, I've talked to the producers because we have an office about half an hour away from that lady. I'm going to see whether we can provide care to that lady because I know we've got availability in that area. I know we can help her.
Well,
But it's where the money comes from, isn't it?
Yeah. Can you explain that to us? Because they've been told their local authority cannot provide because of the costs. How can it be that you would go to the local authority and say you can provide?
Well, we would go to the local authority and say we can provide, but there is a cost associated with doing that. And it's then for the local authority to say we can or we cannot justify paying for that care. But a local authority has got a duty of care to ensure that people receive that care package. If I've got carers in the area, I know we can help, Charlotte.
Louise, I'm going to give you a last thought on this one because you're the one at the sharp end in so many ways. Are you working today? How's today looking?
No, I'm off today. I think I was on late last night, so I'm off today.
Oh, well, have a nice day off because clearly you have earned that. Thank you so much for sharing your story with us. Good to see you this morning.
Lovely. Thank you very much.
So that's Louise Didlock, Dan Archer, CEO of Visiting Angels Care Agency. Thank you for your time as well.
Yeah, good to meet you. And I'm sure this is an issue we will be revisiting a lot on Breakfast. It's coming up to 20.